Hello, my name's Jacob. Today I'll be doing my NG skill video using my GPSPs. First I would knock enter the room, identify myself to the patient. Hello, my name's Jacob. I'm going to be your nurse today. I'm going to do a NG tube on you. Is that okay? Once you get permission for that, I would then get two patient identifiers. They match, everything's good there. I would then check for any allergies. They don't have any allergies, so I'm good there. Today I'm going to be using a Salem Sump dual lumen NG tube. At that point I can go ahead and get my supplies out. I'm going to take my tubing, go from the nostril to the earlobe, down to the xiphoid process, and I'll make a mark there. I'm going to put that down. At that point I can perform hand hygiene. I'll place my waterproof pad on my patient. I'm going to go ahead and don clean gloves. I'm going to go ahead and take my NG tube and go ahead and lube it up. Dispose of that. I would have my patient flex their head backwards, inserting the tube in. Once I get to the back of the pharynx, I would have them flex their head down to the bottom, or down to their chin down to their chest, having them swallow, 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 swallow. Swallow, 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 swallow. At that point, I can go ahead and loosely secure my tube. At this point, I would go ahead and call for a chest X-ray to get to confirm placement. I'll go ahead and draw up some of my stomach acid or stomach contents. I'm going to take my pH test strip and test it. It's at a 5, so I'm good there. I'll dispose of that. At this point, I've got my chest X-ray. I got all of that done. I can go ahead and take this off. I'm going to secure my completely.
Alright, so I see it is starting to gag. I would go ahead and take the water. Yeah, and I would have like so.
Once that's secured, I'll go ahead and take my marker and I would mark my spot again. I would take my tape measure and measure from the nair down to the end, and it is 40 centimeters. And I would document that. At this point, I can go ahead and connect it suction. I would turn it to intermittent, turn it on low, and keeping my blue air vent above chest level. And then I'm going to take my piece of tape and secure it to patient's chest, clean up my supplies. Then I'm going to document, report, and record. Also, if my patient would have had any signs of distress or discomfort, I would have discontinued the procedure and not gone any further.